I'm gonna be your nurse today. I'm performing my hand hygiene and putting on my gloves. How are you feeling, Jay?
Good. I just have a slight headache and I'm feeling a little hot, like I might have a fever.
Absolutely. So we're definitely going to be giving you your Motrin today. Can you just verify your name and date of birth for me?
Yeah, January 410 and then August 23rd, 2004.
Perfect. Thank you so much, Jay. So you mentioned that you're having a fever and a headache, and so because of that, we have our Motrin that we're going to be giving you. This is 200 milligrams of Motrin, and this is your oral medication. I'm just going to go over some oral medication facts with you and teach you how to take your Motrin. So when you go to open your Motrin, you're just going to pop it directly into your medicine cup. Because I have my gloves on, everything is sterile at this point, but once your medication is in your cup, you're going to want to take it with water. An important thing to note about Motrin is that because you have a 200 milligram dosage, you would not want to exceed 4 grams within a 24-hour period. That's a really important safety emphasis because you don't want to overdose. That could lead to death, having to get your stomach pumped, just all kinds of things that aren't really fun. Because you have just a headache and a mild fever, the Motrin is going to help with those symptoms. Another thing about Motrin is you're going to want to keep it stored in a dry, room temperature place. You don't want to put it in water, especially if the packaging gets wet. It could affect the coating on your Motrin, which would impact the dosage that we need you to take to keep that fever down. So you're going to want to keep it in a room temperature setting, stored in a cool, dried place. And this is as needed, so you actually won't have to take it often. If you miss a dosage, it's okay. You're just going to take this as needed when you're feeling those headache symptoms and when you're feeling feverish. So I would love for you to teach back to me how exactly you would take your oral medication.
So I'd keep it in a cool, dry place, and then I would pop the medication into the cup, and then I would take it with a little bit of water. Make sure not to exceed over 4 grams a day, and just take it as needed.
Absolutely, perfect. Thank you so much for teaching that back to me so that I know that you have an understanding of how exactly to take your oral medication. Do you have any questions for me?
No.
Okay, I'll just give you a little bit of facts about Motrin then, since you don't have any questions for me. Motrin is going to decrease the prostaglandins, which are chemicals in your body that cause you pain and inflammation and fever. So by taking this Motrin, you're going to experience less pain, and it's really going to help you with those headaches and fever and muscle aches. And Motrin is just the brand name for ibuprofen. This is just our non-steroidal anti-inflammatory drug.
Okay.
Great, and thank you so much.
Thank you.
Yay.